Hi, my name is Emily. I'm going to be your nurse today. Can you tell me your name and date of birth? Mrs. Bull. All right. And what is your date of birth? 10/2/1935. All right. Thank you. So I'm going to go ahead and do a little assessment on you today, and then we're going to go ahead and get into the new doctor's orders that we have for you. And we'll talk a little bit about why you're here, and if you have any questions, I'll go ahead and answer that, okay? Alright, so the first thing I'm going to do for you is just do a little assessment, listen to your lungs, listen to your bowel sounds, ask you some questions, okay? Alright, so I'm going to have you turn your head, and I'm going to be checking for JVD, which is jugular vein distension. Have you turn the other direction? Alright, so you don't have any jugular vein distension is a sign of fluid overload. Okay, I'm going to check your arms for swelling. She has no swelling in her arms. Can you go ahead and push down on my hands? Awesome, and pull up. Alright, and wiggle your fingers. Okay. Are you having any pain in your upper extremities? No? Alright, that's a good thing. I'm going to go ahead and take a listen to your lungs. Alright, I'm going to listen to your back. I'm going to do 8 on the front, 10 on the back. Alright, you do have a little bit of bronchi in your lobes, and that would be part of the reason why you came in, and that could be a sign of some wheezing. Alright, and I'm going to go ahead and palpate your, or listen to your bowel sounds. Are you having any pain in your stomach? No? Alright. Alright, you do have active bowel sounds ×4, all quadrants. I'm going to go ahead and palpate. She doesn't have any tenderness in her stomach. It is flat, round, it's not distended. There's no hard spots. I'm going to go ahead and look down at your legs, checking for some more edema. She doesn't really have any edema in her ankles or in her knees. I'm going to check her cap refill, and it should be less than 3 seconds, in which it is. I'm going to have you push down and push up. Are you having any pain in your lower extremities? No? Alright, sounds great. So, when you came in, you thought you had possibly had TB. Have you traveled anywhere lately? South America? Okay. Are you having any fevers, chills? Yeah, your fever was, when you came in, 101.2. Your blood pressure was 146/78. Respirations were 24, your heart rate was 92, and your O2 stat was 90 with room air. So we're going to go ahead and give you some oxygen because we want you to be at least 92%. And if you are lower than that, we'd like to go ahead and give you some oxygen on low 2 liters just to keep you from going too low. I would also check at the very beginning if she had an IV, if she had a catheter, double checking that the lines weren't kinked, that the IV was running properly on the machine. Check her surroundings to make sure she can get up without any obstacles in her way. Get to the bathroom, making sure her room is well lit. So with what we're going to look at is a possible TB. So the doctor has ordered me to give you some O2 to help with that oxygen level from being 90% and bringing it up. And then we're also going to do a chest x-ray, a sputum culture. I'm going to go ahead and give you a TB shot. It's a PBD tuberculin skin test. And what that is a purified protein derivative. And we're going to insert it intradermal, so it's going to be right underneath of the skin. It's going to give a little bubble underneath of your skin showing that I did it correctly. And then we're going to recheck it in 48 to 72 hours. And if it's positive, it'll be 10 millimeters or greater. If it's less than 5, we know it is not positive, okay? And then the reason that the chest x-ray was ordered for you is because if a TB has come back positive, we want to look at your lungs, especially because you do have some bronchi in your lungs as well. So that's a indicator that something is going wrong. And then we're also going to give you some rifampin, 600 milliliters PO during once a day, because that is to help treat your TB if it comes back positive. So go ahead, I'm going to give you your oxygen, and I want you to keep that on until I come back here in a minute. I'm going to go grab all your supplies to give you your TB test, and then we'll talk about a little bit about what rifampin is, how we take it, and any side effects, okay? All right, I'm back, okay? Can you tell me your name and date of birth? All right, awesome. Do you have any allergies of any sort? No? All right. So I'm going to go ahead and give you your TB shot. Like I said, I was going to go get the stuff and come back. All right. So what I'm going to do is I'm going to draw up 0.1 of this medication, and we're just going to go ahead and insert it right underneath of that skin. It's not going to, you're going to feel like a little pinch, but after that, it'll be okay. So what I'm going to do is I'm going to take an alcohol prep pad. I'm going to take it, and I'm going to do it on the inner portion of your forearm, and just clean in a circular motion outward. Okay? I'm going to let that dry while I go ahead and draw up the medication. So I'm going to instill air and draw back 0.1. And there's 0.1 in there. Okay, I'm going to pull the skin back, and I'm going to go in at a 15-degree angle right underneath. Insert. Okay, slowly. Okay, and then pop back and make sure there's a well there. If there was not, I would need to redo it because it was going in too far. But there is a little one. Okay. And I would never recap this needle. I would throw it in the trash, but for these purposes, I need it for other days. Okay, so I'm going to go ahead and take my gloves off. I'm going to wash my hands. All right, so since that is in there, we're going to go ahead and wait 72 to 48 hours and double check that, come back and check that for you. And then if you have any questions, go ahead and put your call light on, and I'll be back in to talk to you, okay? Knock, knock. Hi, I'm Emily. I'm going to still be your nurse, okay? It's been a couple days. I'm going to come back and I'm going to check that reading on your arm. And then if it is that positive, we're going to go ahead and administer your rifampin, okay? All right. So it does look like it is raised, and it is 17 millimeters on your left arm. So I'm going to go ahead and give you your rifampin because your chest x-ray came back, and it also shows that you're positive for TB. Okay, so with rifampin, we're going to give you 600 milliliters, a 600 milliliter tablet once a day. We're going to give it with you a full glass of water and on an empty stomach, so we can take it either an hour before meals or 2 hours after a meal. And then you could have some side effects of an upset stomach, a headache, some nausea, some heartburn, and dizziness, things like that. So if you get any of those, go ahead and let me know, just so I can monitor those and they don't get any worse. Okay, so I'm going to go ahead and give you your pill, and then just go ahead and drink this glass of water. All right. All right, so we're just going to go over the rest of all the information that the doctor has given me, just so you kind of are aware of everything that's going on, and so you kind of understand what TB is a little bit more. So TB is tuberculosis. We do find that if you do counteract with it, if you've been exposed to anybody, traveling does show some cases a lot more people get as well. So diagnostic tests that we ran on you were a CBC, a sputum culture, a chest chest x-ray, and those just help us completely rule in or out that you have TB. TB causes some breathing problems, productive cough. You might have some sputum coming up with that as well. And we test by injecting some of the basically TB into your system, and if you react to it, it shows that you possibly have been exposed. And then the chest x-ray is what's help us confirm that you do have it. We also did blood cultures. We did 2 of those. And so we're going to go ahead and give you rifampin, isoiazide, 300 milligrams PO every day, so by mouth. Pyramidine, 1,500 milligrams by mouth, and ethobuterol, 1,200 milligrams by mouth daily, okay? So we're going to keep you on your O2 to make sure that you are keeping it 92%, but we want you to understand that you might have to take these medications for 6 to 12 months, but we don't want you to stop taking them if you start to feel better. You want to make sure that you are completely taking all of these medications and you're not stopping them, because that can lead to drug resistance, and if it would come back for you, you wouldn't be able to be treated with these medications that do treat the TB. We want you to make sure that you are reporting any difficulty breathing, worsening in your cough, if you have more blood or if you have any blood in your sputum, to let us know so that we can monitor that. But as of right now, you are going to get to go home because you have been treated for 3 weeks of this therapy, and you have tolerated it well. You are going to get to go home with these medications, but you do need to continue. So if you have any of those signs and symptoms, if you are starting to feel worse, make sure you give us a call. But we do advise you to not travel for the next 6 months. And again, to make sure you continue these medications until they are gone. It could be 6 to 12 months, and do not stop it because you could get some resistance if you do stop. Do you have any other questions for me? No? All right, well, I'm going to go ahead and get all your discharge papers, and I'll be back in to talk to you soon, okay? All right, thank you.